Hello, and welcome to the High-Risk Perinatal and Newborn Intensive Care Program training module. This is an overview of Arizona's one-of-a-kind program that is implemented at your hospital. At the end of this module, there will be a quiz to assess your knowledge on the program. Should you have any questions or need more clarification, contact your hospital's HRPP liaison. The goal of this module is to educate you on the importance of this program, clarify the steps to implement it, and expand on the positive impact the program can have on qualifying families under your care. The HRPP NICP is a comprehensive statewide system of services dedicated to reducing maternal and infant morbidity and mortality. The program provides a safety net for Arizona families to ensure the most appropriate level of care surrounding birth, as well as early identification and support for the child's developmental needs. In the late 1960s, Arizona faced inadequate care for premature infants and was ranked 45th in the nation in infant mortality. In 1967, in an effort to address this issue, Arizona applied for and received a federal demonstration grant. The grant was designed to reduce infant death by transporting critically ill infants born in rural hospitals to intensive care centers and providing follow-up for 1 year. Professional education and training were conducted for physicians and nurses. St. Joseph's and Good Samaritan hospitals were piloted as the initial intensive care centers where the critically ill infants were transported. The program also provided in-home follow-up through community nursing services. Over the decades, the numbers have fluctuated, but evidence shows the HRPP NICP program has helped Arizona to decrease infant mortality rate. In 1972, the Arizona State Legislature provided funding for the program, which eventually became Newborn Intensive Care Program, NICP. In 1975, through a grant from the Robert Woods Johnson Foundation, Arizona began to develop regionalized perinatal care with a focus on maternal transport and guidelines for Level 1, 2, and 3 perinatal hospital services. In 1977, it was demonstrated that following the acute phase of their illness, babies did very well if transported to hospitals closer to their home. Therefore, back transport was added as a component of the NICP. The program name, High-Risk Perinatal Program, was created to better represent the additional components added to the program. These two acronyms are used interchangeably. For this presentation, we will refer to the High-Risk Perinatal Program and the Newborn Intensive Care Program as HRPP only. Currently, the HRPP program is a statewide program that contracts with approximately 67 agencies and organizations. These program partners provide both forward and backward transport, inpatient services, and developmental follow-up up to 3 years of age. Last year alone, nearly 4,000 critically ill infants were enrolled in the program. Contracted neonatologists and maternal-fetal medicine specialists provide medical consultation and case management related to treatment and stabilization. If needed, the specialists provide authorization for transport to a higher level of care. After the acute hospitalization, infants may be moved back to the hospital nearest to the family, allowing families more time to visit and learn to care for their baby. Community nursing services facilitate the transition of the infant and family from hospital to home. Periodic monitoring of infants' medical and developmental needs up to 3 years identifies infants who would benefit from referral to other early intervention programs. Through these home visits, the families receive support and education as well as referral to appropriate community resources. Your knowledge of the program reduces infant morbidity and mortality. It provides a safety net by empowering families, and it supports families through compassion and education. Now you know a little about the history of HRPP. Let's talk about your involvement in the program. It will be your responsibility to educate families on the benefits of signing up for HRPP. First, let's start with who's eligible. Eligibility includes all families residing in Arizona at the time of birth, plus one of the following: the infant having 5 days in a special care nursery or NICU, the infant discharged home and then readmitted to the special care nursery or NICU, infants enrolled at the request of a contracted neonatologist due to developmental concerns, and lastly, infants born out of state who spent time in a special care nursery or NICU and require follow-up services after moving to Arizona. Once an infant qualifies for HRPP, the family should be introduced to the program. ADHS provides a comprehensive parent handbook at no cost to the hospital or the family. This booklet is printed in both English and Spanish. Just flip it over. You should share this parent handbook with the family, thumbing through and pointing out highlights of the program. Inform the family that you will return to answer any questions and to assist them with filling out the paperwork. Families may feel at conflict when enrolling in the program. Ensure that they are aware that the HRPP program can limit your family's out-of-pocket cost. It provides community health nursing follow-up services. It eases the transition from hospital to home, and it provides necessary transport services to higher levels of care and back transport services. The first step in the enrollment process is to complete the request for participation forms. After an infant's birth, families have 30 days to enroll in the program. There are 2 pages titled Request for Participation and 1 titled Financial Worksheet and Questionnaire. Best practice is for you to fill out these forms as completely as possible, then meet with the family and complete the process. Page 1 includes demographics and contact information, which will be shared with the community health nurse upon discharge. Okay, let's fill out page 1. Hospital personnel are responsible for completion of all forms required for enrollment. Designated hospital personnel shall interview families in order to complete the forms. The forms are fairly self-explanatory, so we'll go over just a few of the required lines. The first box is the infant's last name. This will be the name used on the hospital label. The alias name in box 7 will be either the given name or the mother's last name, whichever wasn't used on line 1. When filling in the address box, be sure to use a physical street address and not a P.O. box. The only time a P.O. box is acceptable is if the family resides on tribal land and there is no physical address. Box 18 will be your hospital unless the infant was transferred to your hospital before day 5 of life, in which case you will fill in box 19, current hospital. In case of DCS custody or foster care, fill in all boxes listed under the primary caregiver and contact information. Remember to affix the hospital label on the top right-hand corner of the form. Page 2 of the Request for Participation is where families will choose between full or partial participation. Full participation includes financial assistance and in-home developmental follow-up by a community health nurse. Partial participation includes in-home developmental follow-up, but does not include financial assistance. Requesting full participation is always encouraged. Point out that should the family choose partial participation, they may only make a request to change to full participation within the first 60 days after birth. It is important that both the parents and a hospital representative sign the form. Should the parents not be available, a telephone call with the notation that consent was given via telephone, including the name of the parent authorizing participation, and a hospital signature is sufficient. A witness signature is preferred when possible. When an infant is to be placed in foster care, either the birth parent or a representative from the guardian agency may sign the form. If no one is available upon discharge, a hospital representative may sign. For all DCS and foster care cases, make sure a contact name and phone number is documented. The financial worksheet and questionnaire. You will need the family's assistance in filling out this form. If the infant has access, then mark access, eligible, and record the infant's access number. Record the number of members in the household and draw a line through the rest. The family liability for an infant on access is 0. A family with third-party private insurance will take a little longer to fill out. Even families having what may be considered good insurance may benefit should their private insurance not cover all inpatient or transportation costs. Families that choose full participation and have third-party private insurance must fill out the entire form. When choosing full participation, the family may still be responsible for part of the bills. The amount a family pays out of pocket is called Family Financial Liability and is based on the information provided on the financial worksheet. The Family Financial Liability sets limits on the amount that contracted medical providers can bill the family. Program Family Liability is not the same as the family's insurance deductible. The left side of the page records family size and income. Include all sources of family income. Take the total gross household income B and record it on the right side, also in the B column. Now for medical expenses. Medical expenses allowable are everything incurred from the infant's date of birth back to 12 months prior. All vision and dental expenses, insurance premiums, mother's prenatal care, as well as other miscellaneous medical expenses. Have the family calculate the sums as best as they can. Take the total and record on line C. Deducting the expenses from the household income will create an adjusted gross income. This is the number you will use to calculate the family's liability. Here is an example of a completed financial worksheet. With access, participants do not have to fill out the middle portion of the worksheet. Without access, the whole worksheet should be completed as an estimate. In the event the family's financial situation changes within 60 days of the child's birth, the family can call the hospital liaison and request a revised financial questionnaire. An example would be a father or mother choosing not to go back to work once an infant is home. The family liability is a term used to describe the total amount of money a family will be required to pay for services provided during the infant's hospital stay. The services covered are inpatient and transport-related only. The time period covered is from the infant's initial enrollment until his or her final discharge. HRPP Family Liability identifies 16 income ranges based on the Federal Poverty Guidelines published in the Federal Register. To determine the family's liability, locate the correct family size in the furthest left column of the table. Locate the column up to the family's adjusted gross income. Let's say our family of 3, baby girl Doe, and her parents are not on access. They have an income of $75,000 a year. The family would then have to pay $9,400 before HRPP can step in to help alleviate the burden of hospital expenses. If the family's adjusted gross income is higher than the highest income within the table, the family would be eligible for partial participation only. If the family size is more than 10, use the values for family size of 10. Be sure a hospital representative and the family sign the financial worksheet. Record the family liability in the inside cover of the parent handbook. Give the family a copy of all forms and suggest they fold it and keep it in the booklet for future reference. Remind them that should they receive a bill for inpatient or transport services once they are home, to contact the HRPP program at the number printed on the inside front cover of their booklet. NICP is not insurance, it is a payer of last resort. Call the HRPP claim specialist at 602-364-0058 or ask the hospital liaison for additional information on financial liability. The family is now registered for the Newborn Intensive Care and High-Risk Perinatal Program. But wait, of course there's more. There's one more form that needs to be filled out. That form is the discharge form, but we will address that shortly. Now that the request for enrollment is filled out, it needs to be submitted to the Department of Health Services HRPP program. The designated liaison will submit paperwork via a secure email. All forms must be accompanied by an enrollment log. This enrollment log states the date sent and what exactly is included. All forms must be received at the state within a specific time frame. Your liaison keeps track of all the paperwork. Monthly, the state sends the liaison 3 reports: the enrollment report, which lists all infants enrolled, the compensation report, which lists all enrollments the hospital has been compensated for, and lastly, the non-compensation report. Your hospital receives $100 for partial and access enrollments, and $250 for enrollments with third-party private insurance. The last report, the non-compensation report, lists enrollments which cannot be processed because of missing information. Liaisons are responsible for submitting this information to ADHS. Common missing information on page 1 includes date of birth and physical street address. On page 2, the signatures. Common missing information on the financial page includes access number and signatures. The discharge paperwork is completed once the infant has been discharged, transferred, or has passed away. Families experiencing demise are encouraged to sign up for the program. Community health nurses will follow up with the bereavement visit upon request within 7 days of receiving the referral. When filling out the discharge form, pay special attention to the box marked Current Hospital. Be sure to record the hospital here. Date of discharge and discharge transferred to are also sometimes missed. On the right side of the form, you will see discharge risk using the medical risk criteria form. You will choose either high risk or at risk. An infant with one of the major risk factors or two of the minor risk factors will qualify as high risk. This discharge form is of great assistance to community health nurses, so include any notes which may be helpful for a smooth transition home. Once the discharge form is complete, your liaison will send it along with an enrollment log to ADHS, just like the enrollment forms. Ensure information such as the date mailed, the hospital name, and liaison's name are included. All HRPP forms are printed on NCR paper and include white, yellow, and pink pages. The original white form will be kept with the hospital, with the scan being sent to ADHS. The yellow copies are sent to the designated agency, providing the follow-up home visits, and the pink copies are given to the family. Remember to suggest that the family put the forms in their parent handbook for safekeeping. It is best practice to also send the hospital discharge along with the yellow copies to the home visiting agency. That's it. You are now ready to explain the high-risk perinatal newborn intensive care program to all qualifying families and answer all of their questions. To recap, HRPP is a very comprehensive program which includes a vast array of services including transports by helicopter and ambulance, inpatient services, and home visits. It is your mission, should you choose to accept it, to inform eligible families about the program. This program is funded by the state of Arizona to ensure that all critically ill newborns have access to the care they need. The program continues through the cooperative efforts of involved individuals like you, service providers, healthcare providers, and the families of Arizona infants. You have just listened to a lot of information. Let's see how much of it you have retained. If you were given an answer sheet, get it out now. If not, number a blank piece of paper, 1 through 20. Questions will be fill in the blank in multiple choice. Press pause at the beginning of each slide to ensure you have enough time to view all questions. Proceed when ready. Turn in your answer sheet to the supervisor or the hospital educator upon completion. Thank you for your commitment to the HRPP program.